Hi, Laci. You may have seen this before. This is the rebreathing bag. It's going to pump in the anesthetic for you and oxygen so that you can breathe real comfortably, okay? What other questions do you have for me? Well, as an anesthesiologist, my day begins around 6 in the morning. As soon as I come into work, I find out where I've been assigned that day, whether it is an OR or I am in the pre-op room interviewing patients. I could be with mothers in the OB. I could be in charge of the OR that day. There's many places where I could be, but if I'm on call, I'll be working for 24 hours and generally have the following day off. Or my day ends around noon to 7, just depending on what is needed, where they need me, if I'm not on call that day. But it's generally a pretty exciting job. I do love being an anesthesiologist. Makes me happy to make sure people are comfortable, like moms, making sure they're comfortable delivering the baby and happy and healthy, making sure that, our patients going into surgery feel comfortable and relaxed, such as yourself, Laci. So yes, there's many things that I can do in my anesthesiologist role. Do you have any other questions for me before we get started here? Well, there are a lot of things that can be determined as complications, Laci. Sometimes we see a lot of side effects with our patients. So, for instance, if I have a patient taking one of our medications and then suddenly they have low blood pressure or they have a change in their pulse or heart rate, that can be quite scary. That is why an anesthesiologist like myself is always standing by to manually address the oxygen situation. That's what we have these rebreathing bags for, so that we can quickly get in there and make sure that the patient is breathing good. Most anesthesia stimulants are for depressing the breathing. So we just need to be ready for anything that can happen, but rarely does it ever, affect the temperature of a patient or their, or their teeth with the rebreathing bag or a trachea. There's many things that can affect the patient, but we always take good care of our patients by staying close by and making sure that anything that happens, we can jump right on that. I love my job as an anesthesiologist. I've been doing this for years. You may see me dressed a little differently in the OR room. I'm going to be wearing a nice bigger mask than this. I am pregnant, Laci. I have 2 babies inside of me right now. I have twins, so I'm going to be taking extra precautions this surgery to make sure that the anesthesia doesn't mess with me or mess with the babies or anything like that. So if you see me in a bulkier mask, I'm going to be wearing a plastic cap. That is just to protect the babies, okay? So just hang tight and we'll just jump right in. Any other questions for me? Sometimes we experience some challenges in the OR or in our day-to-day with the patients, and that's why we focus on our ABCs: airway, breathing, and circulation. These things make sure that we're constantly checking that the patient is under the most comfortable position they can be and that we can take good care of them, okay, Laci? So if you have any other questions, feel free to ask. I am right here available. We're going to be going through your procedure in a few minutes. I'm going to get my gloves on and get my assistants in here ready to prepare. I just want to make sure you are comfortable with me being by your side. And remember, I'm going to administer the anesthetic drug and I'm going to be by your side the entire surgery, so there's no reason to panic or worry. I will be there in case you get nervous or need somebody's hand to hold, and I'll be checking your vitals, making sure that nothing goes wrong and that we can assist you as necessary. Don't worry, Laci, we've had you here before. We're very comfortable with you, and we are excited to jump right into this surgery and make you feel a whole lot better, okay? We're going to fix those boo-boos. So if you just relax, we're going to get you all geared up and ready to go. I'm going to send you with the nurses. They're going to get you in, your scrub, or not your scrubs, you're going to get you in your patient gown. I'm the one wearing scrubs. We're going to get you in a cap and just basically mask you up and make sure that everything is good to go. Alrighty, Laci, if you have no more questions, we'll jump right into it.
Hello, Laci. Hopefully you remember me. I did change for your sanitary experience to be maximized out of my pink scrubs into these purple ones. I'm going to go ahead and be with you throughout the entire surgery, watching your vitals, making sure that everything goes fine. We're going to push the sevoflurane gas, which is an anesthesia drug. It's going to knock you right out, okay? The nurses geared you all up for surgery, so we're going to take you back there and get started with you. I don't want you to be panicked. I'm going to be with you the entire time, okay? Okay. Alrighty. So we're going to need to push a simple anesthesia. Need to make sure the patient is fully knocked out. Laci, hello. Okay, we're going to need some propofol. We're going to need to push another dose of propofol. Don't worry, Laci. We're just going to knock you right out, okay? Alrighty. We're going to need one more dose of propofol so that the patient gets fully unconscious. And I will begin using the breathing bag. Alright. Deep breaths in, Laci. Your nose is going to go here, your mouth is going to go here. I want you to take a deep breath in and deep breath out through your nose. Deep breath in through your nose and out through your mouth, okay? Ready? And... Laci, are you okay? Wake up, Laci. Okay, we're going to need some more corneum pushed through for the patient as a muscle relaxant. All right, now we'll continue to use the breathing bag. Okay, I'm going to go ahead and insert the laryngeal mask airway. Get the mouth opened up, nice and wide, now that the muscle relaxant has gone in. Okay, perfect. Now that the laryngeal mask airway is in, gonna need to check and make sure that it's in the right place. Patient is unconscious, so I will go ahead and check to make sure that it's placed correctly so we can tape it down and begin the process. Just making sure the laryngeal mass airway is correctly placed. Okay. Patient's breathing is fine. Slightly labored. Everything looks good so far. We can go ahead and get started with the surgery. Turn on the machines and begin.